Hi, my name is Sulin Chen, and I'm the CEO and co-founder of Cake. We are the digital destination for end-of-life planning, and we have a mobile responsive web app that makes it much easier to get started. So I just wanted to start off with a statistic. This is the number of people who will die. And this is just to remind us that we all have the opportunity to figure this out, both for ourselves and for the people that we care about. And even though we know with absolute certainty that this is going to happen, the vast majority of us do not plan. And not planning leads to all sorts of bad things. You can lose money, receive medical care you didn't want. Relationships can get torn apart. We see this all the time. And we still don't do it because it's really hard. It's complicated, it's fragmented, it can feel like a chore. And that's why we created Cake. We want end-of-life planning to be more of a piece of cake. And just like cake is a symbol of celebrating life, that's the only reason you do end-of-life planning. It's to ensure that you and your loved ones can live your best lives. And one of our key insights is that unlike, say, taxes, where you're filling out objective information, end-of-life planning is all about highly subjective decisions, and it requires you to have a deep understanding about what's important to you and what your values are about what makes life worth living. And we are the first tool explicitly designed to help you figure this out. We break down planning into simple bite-sized tasks called Cake cards, which we developed with estate attorneys, funeral planners, financial planners, doctors, and more. You simply click agree or disagree, and that forms the scaffolding for your online Cake profile. This is just like your LinkedIn profile, except it stores your end-of-life preferences in these 4 key categories. And then you decide who can see it. It's so important to share this key information with the people around you, because end-of-life planning is necessarily a communal and intergenerational activity. Our vision is that we are the place people go to when they want to think about end-of-life topics. So besides storing and sharing your preferences online, we also cultivate community. We know that people are so inspired by other people's experiences and stories, and it helps them make decisions. We're bringing pure validation and transparency to this space. We also connect our users to the service providers that they're already looking for. And we are the team to do this. Our core competency is in advanced care planning, technology, and business. And my co-founder, Mark Zhang, is actually the creator of the most downloaded app for palliative care clinicians. We have some great initial traction. So over 2,000 people signed up in just 10 weeks, and that was with no marketing dollars spent, all word of mouth. And we're currently running a paid pilot with Liberty Mutual's benefits group, which has a reach of over 3 million people. And this is now, but we have the potential to scale so much more. Our total addressable market is in the billions. So I encourage you all to visit joincake.com and find out how Cake empowers. And I'm happy to take questions. Thank you.
Well, let me start. Sulin, and then I'll go to you guys. One of the biggest challenges, as I understand it, is accessing this information in an important moment, which is often in an ambulance or in an emergency room. And those people haven't received this. So how do you ensure, and oftentimes what they may have received through the family is not legally enforceable. So how do you ensure that it actually gets used at that moment or found at that moment in time?
Yeah, that's a great question. So one of the things, there's 2 ways. So one of the things is we surveyed just dozens and dozens of clinicians, and they said the #1 way to ensure that your medical preferences are respected is to make as many people around you know as possible. So even more important, I mean, the legal documents are very important, but even more so is that everyone around you has an understanding of what your preferences are. The second way is that we're going to be creating wallet-sized cards to keep in a wallet, and emergency responders are trained to look through wallets, and they'll have a one-time use URL that they can look at. And health is the category that's on top, so that's prioritized because that's usually is the one that's the most urgent.
Okay, thanks.
Yeah.
Who wants to go next? Stacey.
Maybe you can share a little bit about the business model, your last slide.
Yeah, sure. I didn't. Yeah, so we always want the basic app to be free, but then we have premium features on top of that, just like LinkedIn. So some of our premium features include our concierge service. We offer consultations, and our users love them, and they say they're worth about $120 a pop. We will also offer storage thresholds, so people can upload documents, rich media, photos, videos, and there is a threshold for that. We've also gotten requests to have more triggered sharing, and so that will also be a premium feature. We're also working with a kind of referral model as well. So our users are already asking us, like 51% want to learn more about life insurance. So, we can certainly kind of monetize that type of referral, but we always want to make sure that we're serving the users and giving them an objective, data-driven recommendation.
Thank you.
Yeah.
So what about the legal part of this? How do you make the choices they make on your site, through the legal system so that they're legally binding?
Yeah, so there's a couple of ways to answer that. So one is that so many of the preferences that are important are actually not necessarily needed to be in a legal document. But we see us as a way to prepare people to really fill out the legal documents that are necessary. We can pre-populate a lot of them. And they're a great corollary to the legal documents, because you're not going to give your loved ones a stack of legal documents to read and say, these are my preferences, please understand them. It's much more human to communicate it in plain English. So it's one, we help people get clarity on their preferences, and then it's a place for all their loved ones to refer. I mean, you don't need to, if you want to have a dance party funeral, you don't have to put that in a legal document for it to come true.
Just with all the changing regulations, especially around end of life and planning, how do you ensure that your clients have the most up-to-date information out there in the industry?
Yeah, that's a huge issue. And so take healthcare, for example, right? It's state by state. It can be changing. And so our goal is just to build out a very wide network of people who are just keeping up to date. We really want to be the resource, a trusted resource, because it is changing all the time. And not just with the regulations, but new companies are popping up all the time, doing exciting things in different verticals and end-of-life planning. So we want to be at the forefront. Or, when Facebook changes their legacy contact, we want to be there and make sure that our users know that, this is not an old article from 2007, that we have all the up-to-date information. It is very important.
The need for your app seems very intuitive, makes a whole heck of a lot of sense. So why haven't there been apps like this previously? And if you didn't exist, what would I do today from a technology perspective?
Yeah, well, you would probably do nothing, because most people do nothing. But so yeah, there's definitely a lot of other entrants, and certainly it's a huge market, so there's room for multiple approaches. What we've seen in the marketplace is that other people are just making a lot of assumptions about what people should do and not really meeting people where they are. This is already a psychologically hard topic, and you're adding a lot of kind of hard tasks on top of that. So we've really simplified the UX and done a ton of user research, and we are confident that we're the easiest to use. I mean, 98% of our users say that an app that helps them think about their death is easy, which we're really proud of. And so we think that the first step is to remove the stigma around it and try to get people normalized and get clarity on their values. We don't see other people approaching it quite in that way.
Can you give an example of how you're going to inspire that behavior change? Because as you've said, the default is to do nothing, and you're enabling it by creating this app. But what are going to be some of the catalyzers of behavior?
Yeah,
So we have a few seconds. So
oh, sure. There's multiple entry points, and so part of it is we really are positioning ourselves not as, it doesn't have to be all doom and gloom. It is actually about what makes life worth living for you, and that can be very motivating and inspiring and cultivate gratitude. And so a lot of our prompts are more around first level setting that and starting about what you love about life, and then moving into more difficult questions.
Thanks so much.
Thank you.